Cheryl, thanks so much for joining. Speaking of making healthcare work for you, different perspectives and empowering solutions. I'm Stephanie Fields, joined by my co-host, Dr. Apoorv Gupta. And today we're talking to Mary O'Connor, who is the co-founder and chief medical officer for Vori Health. Now, this is actually a little bit different because if you watch our show regularly, you know that Apoorv and I always do our highlight video to share what's coming up this week. But we figured that we had a little bit more that we wanted to hear from Mary. And so we would include her in our highlight video. And so we talked to Mary, which is a musculoskeletal, I always have a hard time saying that, virtual company where they're providing a comprehensive approach with a health coach, physical therapists, physicians, surgeons, everybody, they're all working together in tandem so that they can make sure that these patients are actually getting the right care that they need in a really comprehensive way. And it's a really great opportunity because so many people, Mary told us during the interview, and Mary, you can correct me if I'm wrong, there are 3 categories for these types of patients. You either have the ones that you know definitely need surgery, the ones that definitely don't need surgery, and then you have this big group in the middle that, you know, really could go either way. But by using the approach that Vori Health has pioneered, they're able to take these people and care for them properly, really figure out why they want to fix whatever their knee issue is, whether it's playing with their grandkids or if it's running a 5K, because that could change what the approach is, and then working with a physical therapist, and then, you know, going through these and avoiding surgery when possible, but sometimes it is needed, and better mentally preparing them for that. And so I thought it was a neat collaborative approach. And Apoorv, it's something that we hear all the time in all of our interviews, that the key is communication, it's the emotional connection, and it is working as a team. So Apoorv, before we toss it to Mary, tell us what stood out to you after talking to her.
I love it. Yeah, I think that it's coordinated care, it's integrated care, it's kind of getting all the necessary care providers together to meet with the patient pretty much in the same setting, so that by the end of the setting, the care team can kind of put their heads together and say, this is what we think the patient needs, which is actually really not happening in the real world. There are some providers like Mayo Clinic that can try to do that in the physical space, but unfortunately kind of missing in the tele world. So I find that Vori Health and Dr. O'Connor's work here could really be groundbreaking in that they're trying to put it all together in the virtual space. I love the idea that they're using a health coach as kind of the glue. We've heard about this kind of everywhere. Almost any company that's trying to make any advancement right now has realized the power of the health coach. These are people that don't even have a detailed medical background. They may not have certifications, but they care about patients. And they care enough that they're able to make connections that unfortunately care providers who have been trained for 5 years, 10 years or more are not able to establish. So I think that they've got the right elements, and clearly technology is in the mix. They understand how to leverage technology, as Dr. O'Connor said, so that you can create scale and reduce costs. So that's what's intriguing to me. And with that, Dr. O'Connor, would love to get your thoughts on things that you didn't get to share with us during the interview.
And share about your impressive background. You've spent a lot of time at Mayo Clinic and at Yale before starting this. And so, like Apoorv said, we really just want to hear a little bit more about what took you from there to this. And I would like to note that you've told us before that you said you are pro-surgery for the right patient, which is important.
It is important. So yes, I did my orthopedic surgery residency and fellowship at Mayo Clinic Rochester, and then went down to Mayo Clinic Florida, where I spent the majority of my career. And I love Mayo, and I've always felt that I've taken my Mayo values, particularly that the needs of the patient come first with me wherever I've gone and with whatever I'm doing. The challenge, and then I was recruited to Yale to be the inaugural director and create an integrated musculoskeletal center. I had the opportunity to co-found Vori Health, and saw the ability to have a much larger impact in terms of transforming the delivery of musculoskeletal care. Again, taking that integrated model where we're looking at patients much more holistically, biopsychosocial, nutrition, sleep, anxiety, and recognizing that those are all important to whether their back pain is going to get better or their knee pain. And remembering that, yes, absolutely some patients will need surgery, but there's a lot of patients that we can help get better who don't need surgery. And how can we deliver that in a much more integrated way, recognizing the power of the mind and nutrition and these other factors that often in traditional systems we've ignored is too strong a word, but we haven't been able to focus on because we don't have the resources in a traditional system, and the payment structure is not set up to reimburse providers to do that work. So I'm very excited. I'm having a lot of fun, and hopefully all the viewers will enjoy our session.
Well, thank you so much for being here, and thank you all for watching. Be sure to stay tuned for the full interview with Dr. O'Connor on Thursday. We'll talk to you soon. Bye-bye.
Bye-bye.